A very good evening to all the medicos out there. This is your host, Dr. Rishika. I'm going to host this interview with Dr. Ankit, who is our Chief Anatomy Educator, with Dr. Shakti, who is our Chief Physiology Educator, and Dr. Abhijit, who is our Chief Biochemistry Educator at Auricle platform. With over more than 20 years of combined experience of teaching MBBS students, these teachers are known for their excellent teaching style and engaging methods, which makes studies and the first year course very, very easy for all the medicos out there. So, so, first of all the dear medicos, congratulations for clearing the NEET with all that NEET scam and everything. Finally, you are in your med school and you will be starting this roller coaster journey. And I know the first day of the mid school, I still remember the day when I was having a lot of butterflies in my stomach too. So I know how this feeling is. And yes, the thing that we see that med school is like a fairy tale, it's not like that, obviously. It's like a hill with lots of ups and downs, and we have to tackle each problem and we overcome it, and then we are at the top of it. So, with all the educators today here in this meeting, will know how to deal with these subjects, how to deal with this course, professional course, and how to overcome all these problems. So, firstly, good evening to all the teachers here. So, Dr. Ankit, sir, I would like to know about your MBBS journey. Like, what motivated you to become a doctor, and how was your journey?
First of all, thank you, Dr. Rishika, for connecting us. And it is a proud moment for any educator to connect with the new generation of medicals. So, as the question has been asked about MBBS journey, each and every individual has obviously a very personalized MBBS journey, and obviously starts with so much of this doubts in mind, what will happen the next day and all that. I mean, when I entered MBBS, there was not much of internet and all that, because in the final year only we started using internet. So my batch is a bit old. So it was total raw. We only used to face seniors like just face to face, and we had an interaction that only. Ragging, fortunately or unfortunately, was quite prevalent at that time. So it was also a mix sort of
Exactly, sir.
it was a mix sort of you can say entry into the MBBS. And let me tell you, and that MBBS journey, as you guys are in the first year, and nowadays so many of things are going on about being a doctor, should be, should not be, future this and that. Let me assure you,
Exactly, sir.
it is one of the rare professions in the world where you can directly impact anyone's life. It is correctly said to be like the messenger of God, or the this God's another this avatar on land and all that. So be assured, it is
Yes,
one of the best professions that you can take and enjoy it, and keep on studying, keep on revising, keep interacting with your seniors, have guidance, and enjoy and have a good life. And I assure you all the best. Wish you all the best for your MBBS journey. So that is all I want to
yes,
say
sir.
in this. Thank you.
Sakti, sir, I would like to know about your MBBS journey and your journey as a med educator. Can you please share your experiences?
Okay. So when you talk about my MBBS journey in general, it's kind of generic, like a lot of people. I guess at that point of time, you're good at biology, you're not that good at mathematics, and then you only have one choice, either take engineering. We were raised in a time like that. Of course, nowadays people have more options.
Right.
So I took MBBS like that. Um, Before that, though, I was in a coaching center, actually, plus one, plus two, studied there. So,
Okay.
I had to study hard. A lot of good teachers were there. And when I joined MBBS, I was mortified because the standard of education, as I was used to receiving, just dipped down. You see a lot of teachers just reading PowerPoints,
Yes,
nothing was
sir.
making sense. Now,
Exactly,
I'm one
exactly,
kind of a
sir.
student. Basically, if somebody teaches me, I attend the class, I study that topic. If they don't, basically I
Okay.
don't. So I was a student like that. So if I think back now, my MBBS is just a blur because I can hardly think of, very few teachers were there. Uh, so that was basically my MBBS journey. When you talk about how I became an educator, thing is, even before I took MBBS, I wanted to teach. Like I used to love,
Okay.
Teachers' Day, and you would go and teach. So I was having this conversation with my
Wow.
mom. Okay, mom, maybe I don't want to do MBBS. I want to maybe go into teaching. But she is in microbiology. So she told me, okay, you take MBBS, you don't like it. You can always go into non-clinical and teach. So I was still not sure. Then first year, I was actually struggling. As I was telling, nothing was making sense. So there was this one teacher in my first year. She was in physiology. So somewhere in the middle of the year, she started teaching, and it piqued a lot of interest in me. And I started studying,
Okay.
and I started loving the subject because of the teacher. And
Mm. Oh my
at the end
God.
of the first year, I was like, I got distinction marks in physiology. On the other hand,
Oh.
biochem, sorry, sir, but I passed by just two. So that is like,
It
the
happens
hell and
with
heaven
all the
difference.
medicos out there.
So after that, when I was an intern, I started loving surgery and all that. Then finally, after that, I was mulling over the fact whether I should go into surgery or take physiology up. That is when I went into this entrance coaching 1 year. And, I saw amazing teachers. I was learning MBBS as if I'm learning for the first time. Everything started making sense. And it, occurred to me that, this is what I want to do in life. The impact of a really good teacher. And, that is how I decided to be a teacher, educator. And I will never look back on this because, I seriously don't feel like I'm working even. So that is it with my
Okay.
journey of everything.
So now coming to Abhijit, so what you'll say on this? Like, why this biochemistry is just so less engaging for this students, and what
See,
motivated you to become a biochem teacher finally?
firstly, as Shakti sir said, like after getting after plus two, no, my parents assured me no, everything would be fine. No, you are into MBBS and everything will go very smooth.
Yes,
But
sir.
it wasn't like it was a roller coaster ride, I would say. And my personal experience with biochemistry initially was not very good. Like 80% of the teachers over there, no, they just come to like read the slides and they just like keep on
It
reading and
happens. It
yeah.
happens.
See, as a student, when I was in plus one or plus two, no, we have no habit of no learning from the educators. Like we keep on writing notes or like some sort of explanations and this. And suddenly, if no, the way of teaching is like changed. So obviously, it impacts a lot. And obviously, initially it was very very tough, but rather later I just managed to cope up with the biochemistry, and I was having distinction.
Oh
So
my
yeah,
God.
in biochemistry.
Oh my God.
Oh. So yes, later on, like moving ahead, no, when I was in second year or third year, so no, the teachers again were the same. So I would help my juniors. No, I would no have a personal interest, no, explaining the concept, explaining the cycles, and explaining everything to them. So yeah, that somewhat
Wow.
motivated me, no, later to no become a biochemistry educator. So yes. Mhm.
Great, great to hear this. Like, I can't
I've
tell you,
been
like, I'm
teaching
meeting
from the
someone
MBBS
who's
days
got.
now.
Wow.
So yeah.
So I can definitely say like I'm like sitting and talking with the top educators in the country. So, it's really great to hear all about your experiences. So, and what I'm trying, like, what I feel is when I was in my first year, like these 2, 3 months of the beginning of MBBS were like I was just struggling to, figure out how to study these subjects. Like no one is there who is going to guide you, like how you have to start reading anatomy, like what resources you should prefer. It was very confusing at the beginning. So, like Ankit sir, can you please tell me like what should be the approach of a student when he or she is in first year? Like, is anatomy that difficult? Like,
See, anatomy is not easy. I won't say it is difficult, but yeah, it is probably not easy. Particularly if you look at the volume of the subject. Because in anatomy, we have this whole gross anatomy, then comes embryology, then, okay, you are comfortable, then comes histology, then you are near the exam, then comes another small topic, genetics. So, I mean, each part is a subject in its altogether. But before going to discuss this, let me, agree with Dr. Shakti over here, because what he said was a very, very important point, and just that took me by a second. He said that the educator who was very good in his or her subject, and that propelled him to have
Exactly.
interest in that subject. I guess that is the
Yes, sir.
that is our role as educator to inflict
Yes,
the
sir.
interest in the subject, because I've seen myself also in anatomy, many students come and they say, sir, before initially no one was there to teach us anatomy. I mean, to tell how anatomy is so interesting, and then it comes on. Now, coming to what you asked, Dr. Rishika, I was lucky
Yes, sir.
because, as I told you, at our times ragging was at its peak. So we
Yes,
were
sir.
able to open the book after 6 months. So initial 2, 3 months, 4, 5 months, there was actually no chance of opening the book also. We were all the time
Okay.
filling our seniors answer sheet. So, but coming to this
It
part,
happens.
yeah, because nowadays the competition is obviously, quite much there because so many resources are there. So best way to see about the resources and all is that in the MBBS journey itself, one thing which every student should focus on is the standard textbooks at least. That should be number one
Yes, sir.
priority because you have 4 to 5 years. You can't go for a shortcut. So number one priority should be whatever standard textbook is going on in your college. Then comes there should be someone, everyone needs it as a mentor as or as a guide. And here, see, Oracle has come as a very important platform over here because we have seen so many apps which are going around the country. I have myself been associated with many apps before, but Oracle over here has made a very beautiful set of hard copy notes. They have recorded classes which have their own pros and cons that we'll discuss. They have live classes which have their own pros and cons. But here we have a hard copy note set which gives you a question and answer format. So sources of subject like anatomy, I would always say go for the standard textbooks. Most of the country, you take the AIMS Delhi also, their BD Chorsia, we all know that red color book is the number one because it is given in a point format. Then you have different books for say
Yes, sir.
embryology, you have different books. I would say at least read Langman's. It is a standard book, but you're finding it a bit difficult. Go for IB Singh. Histology, we have IB Singh book. You can go with Atlas, like Defoe's Atlas or the other atlases. But yeah, this BD Chaurasia, and you have one embryology book, you have one histology atlas, you have one Natus atlas, and then anatomy is something which you have to somehow create interest in yourself. You have to find some way out because giving you all the notes, all the books won't suffice. Being a
Yes, sir.
faculty in medical college from the past so many years, it is my what practice I have made in the past 10 or 15 years is that whenever the first year students comes to our department, my main objective in the first 2, 3 days is to ask the student that why he has joined MBBS. Because I assure you,
Okay.
more than half of the students, they are not sure why they have come into this professional degree course. So once and they
Exactly,
understand
sir.
what is the meaning of a doctor, what they will become after 5, 6, 7 years, then they start to have some interest in what is this body. Then the interest will automatically come. So interest developing, good sources. Oracle has come here with a beautiful hard copy note set and all those modules and recorded classes. I guess this is how we can approach to this subject. And if you break the subject, the journey becomes very smooth and fine, and that will make the journey good. That's all I want to say about that.
Exactly, sir. Exactly, sir. Like this is the only problem. Like many students are not interested. They don't know themselves like why they have joined this course. And here comes the
Why,
role of educators like you. And I'm
why
really
comes
glad
before
like
how?
today's
The why comes before
yes, sir.
how. How to do, the first thing what to do. If your why is clear, the how will be
Exactly.
clear.
Then you'll do it. You'll do it for sure. So that is the reason like we need such platform, and I'm glad like art medicos in today's era they're having like such a platform where they have experts like you guys to guide them and to tackle all the subjects and to develop their interest also. So Saktish sir, can you please tell us like how to like tackle with all the difficult topics and concepts in physiology?
Okay. So this is actually a tough question. Uh, because I think it's gonna differ a lot based on different students, but some general points I can tell you. Uh,
Yes,
so
sir.
the thing is, when students come to MBBS, they, work really hard for two, some even more than that. So the first impulse for them is, okay, done. I'm gonna relax now. Okay, at least for,
Yes, sir.
half the year, out of 1 year, half the
Every
year,
medico do
they
this.
did that.
Like
Everybody
they
does
do
that.
this. Yes, sir.
So what you have to understand is at least, not much, 1 hour per day is not, too much if you think about it. In the hindsight, if you think about it, at least try to spend 1 hour in a day or in the weekends, maybe 2 hours, and rest of the time you can do whatever you want. I know it's easier said than done. Uh, Another thing you can do is, when you're studying
Yes,
also,
sir.
throughout the year, uh, you know, try to study conceptually, like because ultimately you want to become a doctor or a researcher, educator, whatever it is. You gotta try to learn stuff conceptually throughout the year. And just before the exam, like, 1 month before the exam, that is when, you have to start learning specifically how to answer and all that, if you're interested in getting good marks and all. Some students I know are not interested in getting good marks, they just want to pass. So that concept is more than enough for them. Uh, Another important thing is, as a student, learning to take down notes is something very, very important. Because the thing is,
Yes,
when you talk about standard textbook, okay, I can tell you a lot of standard textbooks, but students in first year have to read both anatomy, physiology, biochem, and at their level, it's not something that is very easy to achieve. Okay, for
yes,
me,
sir.
study this textbook, but I can understand it's a little difficult for students. This is where teachers come, their notes come, because a teacher through experience basically is giving you information, the best information possible from multiple different texts. Okay, so learning to hear a class, take down beautiful notes, that would suffice for your whole MBBS journey, actually, if you learn to do it. And then again, especially in physiology, you have to understand what as a student, your way of learning is. Everybody has their unique sense of learning, actually. So some have a
Yes,
more
sir.
visual perspective, some prefer writing down notes after studying, some will,
Yes, sir.
perform better. Somebody else teaches them. So everybody has their own strength, weakness. Identify that. That'll help you a lot. Once you identify that, stick to that, improvise, then you can actually do a lot. And
Yes,
in
sir.
physiology, it's a don't go too much into the detail at your level, at least in MBBS first year level. Understand the concept. For example, you take a subject like, for example, BP. What is BP? Then you keep asking questions.
Yes, sir.
Why? Why does this happen? Why does this happen? Draw a flow chart. You don't need to write, paragraphs and sentences. To be frank, no teacher enjoys correcting papers. Nobody wants to spend, hours and hours correcting paper. They try to finish it off as fast as possible. So, write down
Yes,
in
sir.
points, to draw diagrams. It'll help you a lot, even in your exam. Okay. Um, and Yeah, and another thing is, so this is basically about physiology. Another thing is, if you go to college, a lot of times seniors are going to tell you, oh, you don't have to study much. You'll just pass physiology. You'll just pass anatomy. One thing I
Yes,
always
sir.
tell my students, these seniors, they are still doing MBBS.
Yes,
They
sir.
have not finished MBBS. They have just second
Oh
study.
God.
They have
Yes, sir.
not reached that level, where they have to go through PG and all that. Find me one person who's gone through this hardship of going through a PG, trying to get that entrance, who will come back and tell you, do not study. You'll never find anybody who's like that. Okay, so
Yes, sir.
ultimately you have to
Absolutely.
study. But before that, you have to improvise a little, try to understand. And this is where, platform like Oracle is really good because, live sessions are there throughout. And that is where all of these teachers are always going to be there, to guide you as to what you need to study, how to study, what are the important topics. And that is something really amazing for the students. Okay, and I'm
Mm,
absolutely
definitely, sir.
excited about the future of such a perspective.
Definitely, sir, definitely. So now coming to Abhijit, sir, I have heard like you make your students fall in love with biochemistry the way you teach. Like, what's that trick that you apply while teaching biochemistry? Can you please tell us about it? That secret
Yes.
behind your teaching?
Firstly, I personally believe that there is no secret as such. But no, after passing NEET and after no, the students have like allotted colleges, they are being texting me constantly on Instagram, sir. Why biochemistry? Why we need to study this subject? No, like again, they are
Exactly, sir.
actually rid of chemistry from class 11th and 12th, and now biochemistry is something like see, as an educator, I would just like to tell that biochemistry is simply the chemistry of no the biomolecules. Now, you see any professional course, any professional medical course, whether it is BPT, nursing, no BDS, MBBS, biochemistry plays a very important role. Now, see what is happening in our body. You already know there are various no simple reactions, no biochemical reactions.
Yes,
There
sir.
are all those redox reactions which are happening, and how they are regulated, that like plays a very important role. um okay, let us just I want to take the example of COVID-19. No, you already know,
Okay.
still now no, they are like keeping on no doing experiments and know which mutated virus is responsible for this. They are doing various PCR and all that. So all this comes under no this molecular biology, and this is again a part of biochemistry. Apart from that, no, okay, again, if you go to a doctor, no, if as a patient, if you go to a doctor, no doctor, if you know, the doctor will take the history, will listen to your complaints and everything. And after that, on the basis of the possible no diagnosis, he will be no asking you to undergo a blood test or urine test or something. So what all
Yes, sir.
like everything no this biochemical analysis is there. So that is again where the role of biochemistry comes in. So we cannot tend to escape from this subject, and it has like
Definitely,
various
sir.
even no, you already know the very smallest thing. It is the atom. From atom, no, we have the molecules, and no, we have the cell. Cells, we have different compartments. As many neat students know, mitochondria, cytoplasm, and everything. So all those biochemical reactions, they are all occurring in these compartments only, so in the cell only.
Yes,
So
sir.
again, like we cannot tend to escape to forget it this. Apart from that, as sir already said, videos, everything, but see, all the videos, all the other apps, whatever they are available, they are never a replacement to the standard textbooks. I personally believe
Yes, sir.
reading is very
Absolutely.
must. So you cannot just no stick to only just videos or this. You have to read the standard textbook simultaneously. Firstly, if you need to get a good score, but if you need to pass also, again the role, the importance of books is there. From my subject, like if you ask me, no, the Satyanarayan, the common book that is no being followed
Satyanarayan.
by, yeah, just for like passing only if you just for 1 2 months before. But if I ask students to read Harper's, initially they will like kill me because the language is very
They'll
tough to understand. So yeah, see, what
we
I
can't.
personally believe, key in every medical college we have like biochemistry professors, they will come. Not everyone will not have the same experience like me. They will have some educators teaching them. So obviously, after going through all those things like from the classes, then go back and read the Harpers or something. It will be like way easy for them. But yeah, like
Yes,
if
sir.
they want to prepare for the lecture, they can go for Lippincotts. But we have multiple textbooks.
Yes.
But again, it's see, sitting on a platform and just simply saying the name of the books, and if I ask them to buy everything, it's like doesn't make any
Not
sense.
possible.
So yes,
Yes, sir.
student has to like learn in the form of like okay, especially if we talk about the Oracle's notes over here, they are being curated in the form of Q&A, like the question and answer format. So basically, these have been created keeping in mind all the previous 10-year questions and everything, topic by topic, everything is there. So yes, Of course, it would help a lot. It would reduce the burden as well on the students. They don't have to search for multiple resources and they can just stick to one. So,
Great to hear those tips. Definitely, like all the medicals today need to hear this to develop their love for biochemistry. They need to hear you, sir. So, Ankit sir, like you might have heard, like this next thing is giving us notifications every year, like it's going to held in 2024, 2025. So, can you please tell me and give us clarity over this next?
Yeah, why not? Because it is the top of the town now. And for the past 2, 3 years,
Definitely,
yeah,
sir.
the past 2, 3 years, the notifications are coming, then going back, coming, going back, going back.
Exactly, sir.
So I always say to students, whoever we have a discussion our college, the first and second year students, they're also that some create, I mean, some are anxious or what will happen if next will come, what will happen if this will come. See, the subjects will remain the same, the topics will remain the same, the examiners will remain the same. The pattern may change from A to
Definitely.
B or B to A. That's the only thing that's going to happen. In the notification, we see that, okay, we are going to have exams for 5 days with a gap of 2 days. Like it's going to be Monday, Wednesday, and Friday, right? And we have a break of Tuesday and Thursday, something like that. And the next is divided into next one,
Yes,
next. See,
yes,
for a
sir.
first or second year students, it's not going to be, we are telling them what will happen after 3, 4 years, but just one should have a brief idea in first year student. See that every subject is going to be asked. Like in for the first day, we have medicine and applied subjects. Third day,
Yes,
we
sir.
have surgery and allied subjects. Last day, I guess we have OBG and PSM, something related ophthalmology, something like that. So we have these three.
Yes, sir.
Now, see, we have to understand over here and we have to tell the students, and I want all the students to understand one thing. All the students that MBBS is
Yes,
one
sir.
degree. MBBS is one degree.
Yes,
It has 19 subjects, but again, it is one degree. Which subject
yes, sir.
weightage is more or less, it is nothing like that. Anatomy is
Yes, sir.
applied everywhere. Anatomy is applied in surgery, in radiology,
Everywhere.
in ortho, like physiology is applied in patho, medicine, biochemistry applied everywhere. Now, the importance of biochemistry, every student understands once he reaches second, third year. Okay, yes, that we have learned in first year. So every subject is aligned to another subject. So next exam should come because we are, I mean, luckily or unluckily, we copy best. But yes, their best is good in many things, and so we are copying that. Okay, not a bad thing. So yeah, these exams will come, and we have to qualify them, and it will going to replace the NEET PG. Your ranks will come. Your registration is dependent on it. Your PG, which branch you will get, is dependent on it. But for a first year, please study the first year subjects. Don't think too much. Yeah, keep your eyes and ear open. You talk to seniors once in a while. Okay, sir, this is happening fine because the subjects are same, the topics are same, everything is going to be same, only the pattern is going to be changed slightly. So don't worry too much.
Yes,
That
sir.
is all I want to say, for at least for a first year students for the next exam.
Definitely, sir.
Yeah.
Yes, sir. Definitely. That might have cleared the doubt of a lot of medicals
Hope
here.
so.
So, no, sir, definitely. So, sir, like back when I was in my first year, also, this was the confusion with me also, like what resources I should go for. Should I go for some video lectures or modules or these international books or just lectures of my notes? So, sir, can you please, Sakti sir, can you please give us a few clarity about the beautiful Auricle notes, like how they are designed to benefit the student to clear the concepts of first year?
Okay. So again, as we
Like
were all
how they are
talking about,
different, how they are, yes,
if,
like how they are different from other platforms, and like what benefit a student can get from those modules if they don't want to spend a lot of time on reading these textbooks.
okay. So when we talk about other platforms, most of the other platforms are emphasizing your NEET PG. So that is
Yes,
one thing that you have to understand. Students don't get it. Okay, they take membership in that. So NEET PG is different. It's just a very concise version, especially, when you come to your first year subjects. It's like you have to
yes,
learn
sir.
this much for your first year exam. But
Yes,
for
sir.
NEET PG, basically it's this much. So you are
Yes, sir.
trying to study that those materials like that, I'd say for your MBBS first year UG exam, that is not enough, not good enough. You need to lay your foundation. You have 1 year to study this. So the thing about Oracle's book is, it's there in all the subjects. Multiple copies are there for each subject, and there's also a separate practical book which is available. The thing about it is made in such a fashion that first there's a question,
Yes, sir.
and these questions are previously asked questions. So just before the exam you go,
Okay.
you don't have to read the answers, go through all the questions, flip through the pages. You already have a huge bunch of previously asked questions. Now those of the questions that you have to read a little, you go through it, some points will be there. You'll understand, okay, this
Yes.
is how I need to write this. Okay, these are the points I need to cover.
Yes.
Sometimes, you won't understand, like if you read a standard textbook, I would always say read a standard textbook. But, from a student's
Yes, sir.
perspective, to read a standard textbook and convert it into, enough points to, just for the show and to get marks, it's a little difficult. Okay, a lot
Very
of times, a lot
difficult,
of
sir.
things are scattered here and there, and through years we
Exactly,
learn
sir.
to put everything together. So as a first year student, if something is already there like that, that is one thing. So these questions are one thing. Apart from that, there are MCQs. At the end of each chapter, there are different MCQs, which again will pique your interest. There are fill in the blanks, match the following, that would be enough
Okay.
for different patterns. Apart from that, diagrams, I really love diagrams. Very simplified. You look at diagrams, you can understand everything.
Yes,
Drawing
sir.
diagrams can easily make everybody understand. So there are, like, pictorial descriptions about everything in that, and certain fun zones where some trivia are given. Okay, so, and then even at the end of it, each chapter, there is some special place, a blank page for you to, jot down certain points. So I think, Oracle's book, which is made available, can help
Yes, sir.
simplify learning the subject for students. Okay, definitely it's not a replacement for, your standard textbook. I never say that, but it
Definitely.
is gonna help you in great detail when in simplifying what you have to study. And you see the question and you can go back. Okay, this I can study. This is not enough. I can add more points by reading the standard textbook. So it can help guide you through various questions and different formats and a lot of diagrams.
Yes, sir. Definitely, sir. Like, I have never heard of any platform who is like providing all the things, at a single place in a single textbook. So, but like what, however, like how much we read, but we fail to execute that thing in our exams. So, Ankit sir, can you please tell us like how a student should like prepare well for their professional exams? So whatever they are reading, so they can well execute it in their written professional exams. How they can work on their writing skills, and how Oracle is designed so it can help the student with their writing skills and speed in their professional exams.
Yeah, right. I mean, because see, it's always said, na, we used to joke also initially that there was a student who secured fifth rank in NEET UG, but he failed 12th
Yes,
class
sir.
exam.
Yes, sir. Yes, sir.
So,
That was the
therefore,
talk of the
yeah.
town.
So
No one can
therefore,
forget this news
uh,
ever.
so therefore, if you can't even pass the first year and thinking about NEET or next PG or INI-CT doesn't make any sense. So therefore, for a first year
Exactly,
student,
sir.
should be clear. I mean, see, clarity of mind is very important because we all realize once, like you are in second, third year, you realize, okay, if I would have done that in first year, I would have been done a bit better or whatever.
Yes, sir.
How to do in the exams? See, already students have come passing 12th, 11th, 12th, and 10, 9, 10th, 11th, 12th. A lot of exams they already have given. So normally an average
Yes,
student
sir.
knows how to write in exams. It is just a bit of extra edge or extra help, extra guidance that we can provide. Because normally a student is minimum 17, 18 years of age. He is normally matured enough. He can vote for the government, so he can at least write the professional exam. Now, coming for the subject, how Oracle is helping. Oracle, see, as our Sir Shakti sir and Abhijit sir already told us about the hard copy notes. question and answer format. I mean, it is going to be so much of help to the student, because anxiety is a thing which, I mean, it's there with many students. So if you are seeing a question answer format and you are just reading it and you are understanding and trying to read, understanding it with your live sessions and with the standard textbooks, and you are seeing the question answer, it gives you a confidence. And confidence plays a very important role in giving any exam, be it your first prof. So now
Yes,
you
sir.
are confident. Even pseudo confidence is confidence. So even if you're pseudo confident, it will
Yes,
help you score better, because you already have seen so many question and answers, be it short question, long question,
yes,
flow chart, diagrams, MCQs, blah blah blah, everything. So now you are a bit more confident, which you could not have been, I think so, if you would not have been seeing things like this. So Oracle over here helps a lot. A lot means it's like covering all the areas which a student needs. And
yes, sir.
a simple tips over here. I mean, one tip which I normally say, because how to write, everyone knows their handwriting. One, two tips which I can give is time management. Because
Yes,
see,
sir.
if there are three topics A, B, and C, if I have learned a topic very well, and if that is come in the exam, and B and C I haven't read very well, so A, B, and C are there in the exam, I will devote half of my time to a topic only, thinking as if I will
Yes, sir.
get thinking as if I will get 20 marks out of 15. No one is going to give you 20 marks
Yes.
out of 15. Max you will get 12. So time management is the problem,
Yes,
the thing here. Because 100 marks
yes,
paper,
sir.
time management is the thing. So one is time management, practice that. Second is flowcharts, as Shakti sir and Abhijit sir have already told. Flowcharts are very helpful, because I know last month I've been checking so many papers. Being examiners to many in colleges, I know it's a pain. It's a very big pain. And the students who have written in flowchart manner and tabular form, it helps a lot for an examiner like me and other examiners also. So time management, handwriting, it should be at least understandable. I mean, a very good handwriting. So don't focus on very, very good handwriting. If you have a very good handwriting from the beginning, nothing like that, but at least it should be understandable. Flow charts, time management,
Yes, sir.
some multicolor, like which we normally have seen. I'm not going into the debate, but yeah, girls have a normally good handwriting and they use multicolors also. Normally, that what we have seen
Yes,
in
sir.
our experience. But yes,
Mm.
at least two, three
Yes,
colors
sir.
should be there for a subject like anatomy. Some diagrams, better label diagrams. These are three, four tips. I guess that will be sufficient. And Oracle over here, as we have discussed, helps a lot, and I really think so. So I guess that would be enough for giving the exams.
Definitely, sir. Definitely. Now coming to Abhijit, sir. So when I was in my first year, I also used to run behind my teachers, professors, seniors. So please tell me some important topics, where to focus on, what to focus on, and everything. So they keep on suggesting me to go to the previous year question papers, to go to the last 10-year papers. So can you please tell me like how these past year question papers help you to score well in your exams? Like, do they really play a very important role?
Of course, it plays a very important role. No, as a student, when I was in first year, I also used to run behind my seniors, no assistant professors, everyone, no, to give. I was no running out like with my books to highlight those important topics and just
Exactly,
for the
sir.
sake of passing the exam. But see, as sir already said, one statement that I heard from my teachers is common questions are asked commonly. So when I
Yes,
say
sir.
common questions, it means the important questions that have been like asked in the last 10 years. So now at Oracle, what we have done is like we have collected papers from every particular university, like maximum universities from the
Okay.
last 10 years.
Okay.
And we have like, no, from the last 10 years, like all those papers are being no uploaded in the app as well, so students can actually have an access to all those papers, all those mock tests, even the answers are given. So what actually it will do, it will help to save the time. First thing, it will reduce the effort
Yes,
of the
sir.
student to know go and search for multiple things out there. 1 month or 2 months
Yes,
before, if I ask a student to read a textbook, he would he would never do that, so it's practically not possible.
yes, sir.
But even I have seen students, tending to escape from those mock tests. But as an
Yes,
educator,
sir.
I would say ki we should actually try to give mock test as many as possible. At least 2 months before the exam, we should start it. Because once, okay, let us just take an example. As Ankit sir said, if you are not drawing any flowchart, or if you are just writing in form of paragraphs, as in no, if we are not checking the papers, we would suppose it's a 10 marks question. We will give you 5, we will give you
Yes,
6
sir.
marks. But if you are writing it in the form of a flow chart, or if you're drawing the structure, I'm not asking no students to draw something very fancy.
Yes, sir.
Okay, it should be like technically correct, schematically correct. I'm not asking them to draw something to
Exactly,
show
sir.
their art skills in the exam. It's not possible. But drawing a technical diagram, a schematically correct diagram, writing in points would actually reduce the efforts of no as an examiner to read the paper as well, and for a student to gain 7 or 8 or even 10 marks. We used to tend to give them. So yes, that is something. Now, what Oracle has done is like we have under 20 hours the entire course for like biochemistry, or whether it is physiology or anatomy, it is being covered. All the important topics, I would say. See, we have picked up topics
Yes, sir.
from past 10 years. We have seen what topics are important. I would not say the questions, but yeah, the topic plays a very important role, right? So
Yes,
yeah,
sir.
that we have covered in that particular exam express modules, which is like under 20 hours, and a student can easily cover this. And after that, beyond that, no student can give the mock exams, which are like in the app itself. So obviously, it will save the time to search for on papers everywhere, and yeah. So
Yes,
that's
sir.
how we are helping. If this app would have been available at my time, it would I would have like really benefited a lot. Otherwise, we would have to read the entire textbooks at that time. We don't have any other options.
Definitely, sir. Definitely, sir. So, so I was the one student in my first year who used to attend a lot of lectures just for attendance, because there were some teachers or professors who just came and just read out the PPTs, and ultimately we have to study everything on our own. So, Ankit sir, can you please tell me what a student should do, how we can solve this problem? Like that is
Yeah,
one of
see,
the biggest problem in the whole MBBS.
being a faculty, first of all, what you said, now it is so true, and it is so not good
Sorry,
for.
sir.
No, it is so true and so not good for the country as a whole. Because as a medico, na,
Yes, sir.
when we appoint faculties in medical colleges, we only look at the degrees like for the MBBS or MD or whatever the degree is, but there is no educational training of educator. See,
Exactly,
we
so.
are teaching and we are not trained how to teach. I mean, how can we teach? Simple as that. So that is something which has to be looked at a bigger scale. We can't do much about it right now at this particular position. So you are
Yes, sir.
absolutely right. Most of the students come for attendance. That is absolutely correct. Even if I talk about myself, 90% of the lectures I was there only for the attendance, just to clear 75% so that we can give the exam. So it's a thing over here. Now, what the students can do over here, because attendance is a thing which is mandatory in most of the colleges, you have to go there. And most of the teachers, I admit, they come and they only read the PPTs, and that is obviously not the
Yes,
way
sir.
to teach. I mean, it's a
Mhm.
disgrace to the
Mhm.
profession of teaching. Let me admit it over here. It's a disgrace. We should, I mean, we can read the PPT, but we should also explain to our motive over there is to make the subject interesting, not just to cover the topic.
Yes, sir.
Now, coming to the role of a student now, what can the student do? Because he is the one who is at the receiving end, no? So what can the student do if a student has to attend a lecture in the morning 9 a.m. Suppose the topic is, let's pick up any topic, say heart is a topic, anatomy of heart is a topic, morning 9 a.m. And students are, this a bit excited. Okay, we will study heart, and then they come to the lecture. They after 15 minutes they are like, how to open the eyes. So what a student can do is 15 minutes of the time should be given to the topic. It should is the responsibility of the student. 15 minutes of the time before going to lecture, look at the topic. Look at what are the main
Yes, sir.
headings of the topic. Just read 5-10 MCQs of the topic. I'm not saying the read the whole chapter and all, so that before you sit in the class, no, you have an idea of what are the important
Yes, sir.
subparts or subtopics in this topic. it will delay your sleeping time actually. Initially, you were going to
Yes,
sleep in 10 minutes. Now you might sleep in 35 or 40 minutes, might or might not, I'm not sure. But then there will be
yes,
engagement
sir.
in the lecture. If your lecturer is friendly, you
Exactly, sir.
might ask questions. This is one thing which I always ask my students to at least read 10-15 minutes before coming to lecture. I mean, this is one way which I have made out a way so that students can, have some more interest. Because morning 9, and I know in MBBS, 90% of the students sleep after 2 or 3. So morning
Yes,
9,
sir.
we are calling them for the lecture. It is actually not good because they only slept for 4 or 5 hours. 90% of the students have not taken breakfast. So here,
Definitely.
this practice can help, and obviously Oracle will help over here. You have the recorded classes. If suppose you are not in a mood to read the books and all, you can have it listen at least 15 minutes what the topic is all about. Look at its MCQs. Generate interest of any subject, be it any subject, and then attend the lecture. I'm sure it's going to help every student. This is what I wanted to convey.
Definitely, sir. Definitely. So, I have heard like the Oracle platform is providing a foundational course for 90-day series, which focuses on the pre-final exams or the terminal exams. So, Shakti sir, can you please elaborate about this 90-day foundational course, which focuses on the pre-final exams and help the student to score good? Can you please like brief about the schedule of this course?
Okay. So in Oracle, all the live sessions are made in such a way tailored for different parts of your whole MBBS
Yes,
year. So there's a foundation course, there is pre-exam course, mock tests are there. So this course that you were just talking about. So you give a time frame of an exam which is going to happen probably, for semester, pre-final, whatever it
yes, sir.
is, at the end of 90 days. And through those 90 days, we're gonna help you with live sessions almost every day throughout the week. Okay. And this 90 days will be, targeting those topics which are gonna come for that exam and prepare you throughout so that you can, better appear for that exam and you're thoroughly prepared. So that is like one of the different types of modules and sessions which are there in like classes that are there. So
And like
like
I think the
physiology.
medicals definitely. They
So
need to hear this because it's, October, like all the students are approaching their terminal exams or the pre-professionals or professionals. So they should know about this and go for this course. So now coming to Abhijit sir, so like as you know, like Oracle platform is providing mock papers. Like I have never heard of any platform who is providing mock papers. So can you please tell our medicals like how these mock papers are designed? Like how I have heard like there will be live Viva sessions also one-to-one with the educator and so that student can be more fluent in their professional Vivas and so can you please enlighten us more about this?
Yeah. So as you already know that now there's a quote saying practice makes a man perfect. So that's
Yes, sir.
well goes with this because okay. Now there are papers now which are curated by their expert faculties, right? So we have curated these exam papers, keeping in view the last 10-year papers and adding on to some clinical questions and everything. Of obviously, we are discussing those papers live as well as on the app and also on the YouTube channel. Rather, even no students with doubts, no, they can personally connect to us one to one and they can ask us at any time, right? See, it's very important to practice those questions. See, it will help you in no, the very first thing that sir already told, time management, right? What
Yes, sir.
amount of time you have to spend on a 10 marks question or a 5 marks question or a 3 marks question. Okay, so that is something very very important that will only no come when you like practice mock papers. Without that you won't be able to manage the time, and yes, obviously you won't be able to see if it is a 5 marks question, you cannot write each and
Yes,
everything over there. for a 10 marks question, you have to write each and everything. So over here, when we are discussing the mock papers, no live with the students, we are actually discussing the way also to write the question,
Yes, sir.
how to approach the question in like a way that they can excel in their exams. They can save their time, and all even the important points which are relevant for that particular question are being like covered as well. So yes, that is something like yeah, important as a student to go through it.
I really wish I had these mock papers in my first year so that I could have scored a lot better in my first year professional exams. So I think like now the students, they don't need to worry about their first year professional exams, and for the matter of fact, they don't need to worry about any of their exams in throughout this whole MBBS journey. So now coming to the last segment of this interview, sir, I would like to ask you guys few questions that I've taken from our medicos. So starting with Ankit sir. So can you please tell me like what was that moment in your life, or what was that turning point that motivated you to become a doctor?
Turning
Or
point
it
of,
was just your parents' wish, or you just wanted to be a doctor from the childhood? What was that thing?
I mean, talking honestly, it was a mixture of everything. Initially, there weren't too many options, to be very frank. Once you are good into studies, it was seen whether you are a maths oriented or a bio oriented.
Bio.
So it
Yes,
was
sir.
seen like that.
Exactly.
And
Of
what
course.
motivated me, yeah, I mean, being a doctor was always a matter of pride. I mean, it is also, and it will remain be a matter
Exactly,
of pride.
sir.
So yeah, that was a motivating factor, not that much motivating. Personally, I felt myself that whatever I will do, I will fetch something for my whole life. Means, I mean, life can go easily. You have to work hard. So yeah, medical I entered like this, but the moment I entered medical after a couple of months, I was really mesmerized at what is this place and never thought about it. And as the journey went by, it is a beautiful journey. I would just say that.
Definitely, sir. Definitely. So now coming to Shakti sir. So I would like to draw like attention of all three of you to a very important topic. Like, these days, like security in the healthcare system is the most trending topic these days. So what do you think? Like, are doctors that are working in our hospital 24/7 throughout these long night duties and everything, do they really need security, or our government should really act on this? Why there is so much silence on this? What are your views?
Okay. So let me just divert the attention to one particular thing first, then we'll come back to this question.
Exactly, sir. Because we
Uh,
really,
so,
really need to discuss this.
so one thing I tell all my students is, most of us who are in medicine and all basically have been, bookworm studying all the time. Okay.
Yes,
You
sir.
don't
Yes,
have
sir.
communication skills. Okay. You come
Exactly,
into
sir.
MBBS, if you're studying also, studiously studying, you're all into studies. So people don't know to communicate, to be very frank. So in college,
Sir,
this is
yes, sir.
you explore, get a little bit of intuition, introspect. So learning to communicate is a very crucial thing because especially for becoming a doctor. Because what I learned from my personal
Exactly, sir.
experience is, when I was in Kerala and I was working as a doctor, there were many situations where things had gone really south. And
Okay.
at that time, a lot of times, the fact that I was able to stay calm, talk nicely to somebody was what saved me. Okay, so learning to communicate, and then, everywhere, wherever I gone, I started realizing that, you just spend some time talking nicely to somebody, because they are also at a very bad place. The loved ones are
Exactly,
affected,
sir.
sad. So that is one thing, learning to communicate really effectively. And that
Yes,
is
sir.
one of the things that came in the CBME curriculum because, ATCOM and all that, originally
Yes, sir. Yes,
was
sir.
to, counteract all this if done effectively. That's another story altogether. But apart from all of this, security wise, yes, government has to do more things. I'm not going into more political things, but like I'm just giving an example, like in Delhi and all.
Yeah.
What I heard from people, like few years back, there were issues and all. But in some colleges, my friend who was in RML and all, they appointed bouncers basically, and they
Oh
actually,
my God.
Actually,
managed things really well. So, y- things like that can be done. It's not that it's impossible. So, first of all, as a doctor, you learn to keep your calm. You learn to communicate better,
Yes,
more
sir.
effectively. And
Yes,
apart from that,
exactly.
even government, the institute by itself should do some form of, crowd management and provide security to some degree.
Yes,
That is very essential.
yes, sir. Yes, sir. So now coming to Abhijit, sir, so I would like to ask you a very, very important question. So, like in this profession, there is a lot of emotional investment, time investment, a lot of hard work. We have to sacrifice a lot of things. So, what is that thing at the end of the day that gives you satisfaction while pursuing this profession? What is that thing that keeps you motivated all the time to be a part of this profession, even after
the
sacrificing a lot?
I think the word doctor itself is a source of motivation for many. So yes, being a doctor, it's difficult to know. Being no, firstly a student, actually, it's very difficult to know cope up with all the ups and downs. I already initiated in in the starting only. I told it's a roller coaster ride. Ups and downs will be there. You will be emotionally tired. You will be listening to many things. No, even after like 7 years, 8 years, at 23 or 24, my like friends, they are into jobs or they are like engineers or something like that. But no, spending a little more time than them, and no, going into such a
Yes, sir.
profession, takes a lot of courage as well. But
Exactly,
initially,
sir.
no, relatives also nowadays they start so there is a lot of no negative things, but initially the positivity comes from inside only, right? So yes,
Exactly,
the
sir.
one thing that motivates us is like at the end of no these 7 years or something later in life will be much higher than those around. Yeah, obviously by treating patients, yeah, obviously it gives something like no one can expect, so that's why sir only told with the god. So yeah, we no other profession can match this. Yes.
Now I really feel messed out, sir. Like I honestly am telling this thing. I never had such a conversation even with my professors. So I really feel that this interview is so informative for me, and I'm able to share my thoughts. I'm able to ask questions to you guys. I'm able to get input from you guys, and I'm really glad like today's medicos are having such a platform like Auricle, where along with the expert teachers and guidance, they are getting that emotional push also whenever they need, whenever they feel depressed in their journey also. So like this platform is so beautiful, like everything is a spoon fed here, like students are bound to excel with the Oracle. So I would say to all the medicos out here, just don't panic, just keep calm and trust your teachers, trust the process, trust the system, and just go with it. So I'm telling to all of my juniors here, just don't keep this thing, this Oracle thing, this like a Aladdin kind of thing to yourself. Just share this to your friends, your batchmates, your seniors, and you know where to find these top educators in our country. So this is your friend, Dr. Rashika. For today's interview, I'm signing off. Happy studying, happy Oracle.
Thank you.
Thank you,
Thank
doc.
you, sir.